Big breaking news coming in. Home Minister Amit Shah has put out a tweet post the meeting with the Delhi Chief Minister. Amit Shah has said that in the next 6 days, Delhi testing capacity is going to be doubled. He's also gone ahead and said that AIIMS doctors to provide telephonic guidelines to smaller hospitals. That's the latest coming in. Remember, there was a big meeting that took place between Home Minister Amit Shah, Chief Minister Arvind Kejriwal, Deputy Chief Minister Manish Sisodia, AIIMS Director was present, LG Anil Baijal was also present at this meeting. This was all to discuss how to contain the situation as far as the rising number of COVID cases in Delhi is concerned. My colleague Ankit Tyagi, breaking the story, is joining us now for the very latest details. Ankit, I'm going to throw straight to you on the tweet that has come out by the Home Minister Amit Shah after the meeting with Delhi Chief Minister, mentioning how the testing capacity is going to be doubled. But here's the question. You double the testing capacity, but what about capacity addition in terms of beds and healthcare professionals?
Well, that is what the 7-day plan will look like, which what we have been told by our sources, is that the meeting was quite a fruitful meeting between the central government and the government of Delhi, which also included, as you said, the Chief Minister, Deputy Chief Minister, Health Minister of Delhi, and on the other side, the Lieutenant Governor was also in the delegation from the Delhi, and on the other side was Health Minister Vardhan and Home Minister Amit Shah. Now, what has been decided is that all cooperation will be extended to the Delhi government and to the Delhi government hospitals to, in fact, tackle the workload and the rising number of cases in the national capital. We have also been told that a 7-day plan, which a little bit of that has already been revealed by Amit Shah in terms of testing capacity, but the central government is very soon, in a day or two, going to reveal how they are in fact going to augment the number of beds in the national capital. The government of Delhi has already increased it to about 12,000 beds. Additionally, the central government hospitals have about 2,000 beds as well. Now, the central government hospitals are also going to increase the capacity to deal with coronavirus patients. What we have also been told is that there is complete consensus on the way forward and the plan which is now being put forward. Apart from that, the health infrastructure is being prepared, keeping in mind the rising load of Delhi patients, also of those who can in fact come from outside. So at this point of time, a very important meeting, and in this largely the coordination and better policy for the next few days has been decided. Sources indicating that the central government and the Delhi government are hopeful that by the end of next week, Delhi would be, in terms of health infrastructure, medical professionals, and other requirements with coronavirus will be ahead of the coronavirus curve.
Ankit, the Delhi government had also put out an estimate saying that there could be a possible rise in the number of cases and it could well cross the 5.5 lakh mark in the national capital as well. They are adding capacity, but is the capacity which is increased going to be catering to those many rise in case there is?
Well, that's a number which the government, both at the president and Delhi, in fact, are working towards. Remember, Delhi, this is an increase in the very sharp increase in the number of patients, but it is not going to happen in one day. I mean, the estimate is that the government is hoping, the government is expecting about 5 lakh cases by end of next month, and they will have to keep on stage by stage, keep on adding beds and health infrastructure to cater to that kind of workload. Now, at least at this point of time, even if you look at the number of beds available, the government has enough capacity. But the problems that they are facing are on 2 points. Number one, there is more demand for private hospital beds. That is going to be a difficult thing. And number two, it's just about not about the health infrastructure. Will the government be able to get medical professionals, health professionals and workers to in fact cater to this demand is going to be the big question.
Absolutely, and that question still remains, and we'll wait for answers to come out as well from the Delhi government and the Home Ministry as well. Ankit, continue to stay with us. Kamaljeet Sandhu is also joining us live from Delhi. She tracks the Home Ministry extremely closely. Kamaljeet, as far as the Home Ministry's support to the Delhi government is concerned, what are you picking up?
Well, some key comprehensive decisions have been taken after a massive review which has been done by Home Minister Amit Shah. One of it is that 5 senior officers have been given to Government of Delhi to handle the COVID situation. The NCC, the other voluntary units have been brought in. They will work as volunteers. This is obviously because the frontline workers, we're talking about nursing staff, doctors, policemen who are all on the line. They seem to be somehow exhausted after a 2-month period. And now is a time where volunteer force is really required. This is to ensure that there is social distancing, wearing of masks done by persons. Again, there has been no discussion on extension of lockdown. As rumours had it, Satyendra Jain had already denied it. But very clearly, then they're talking about having capacity building, more beds being installed, at least 500 coaches. And this has been in discussion for quite some time. That at least 500 coaches will be put in trains in Anand Vihar bus terminal, in train terminal. This is to ensure that there are isolation wards, there are ventilators, oxygen, there is obviously all sort of medical facility associated with COVID-19 that is made available. This obviously is a task which is a mammoth one. And remember, Supreme Court has already pulled up Delhi government. They've already talked about how people have been forced to move from pillar to post and not getting proper treatment, being turned away from hospitals, overcharging. These are all considerations which have been taken care of. This is one, there will be increase in testing done. So the capacity is going to be increased almost 60% fold. The other is obviously when we talk about not just testing, but also availability of whether it's hospital beds, isolation centers, all this is going to be increased, and there will be a multi-fold increase. And this is not just that Delhi government is not able to do it. There is some hand-holding which is being done by the centre. There is a subsequent meeting at 5 p.m. and that is also going to be extremely significant because that will involve mayors and that will also involve Home Minister as well as Dr. Harshvardhan. So they are doing some bit of micromanagement because this is not something that can be taken up very lightly. This is the national capital of the country, and this is where the Home Minister has now stepped in. Very clearly, instructions have gone up. They have to pull up their socks, whatever has been happening so far as patients and as far as treatment is concerned, that actually needs to be fortified, has to be increased multifold, is something which has been emphasized on. So what will happen is that 5 officers from central government will help Delhi government to ensure that they have better COVID management in the state.
All right, hold on right there. We're getting a breaking news coming in. Arvind Kejriwal has put out a tweet as well, just put it out in fact. He says, and I quote, extremely productive meeting between Delhi government and central government. Many key decisions taken. We will fight against Corona together. That's the tweet that has come out from Delhi Chief Minister Arvind Kejriwal after that very crucial meeting that took place with Home Minister Amit Shah and many others present right there as well. Ankit Tyagi joins us on this story. Ankit, it's interesting to see that the Delhi government and the central government this time around kept all the politics aside with one aim to solve the coronavirus cases in the national capital. And this, we can safely say, has been an unprecedented health crisis in the capital.
And, it's just not about the government of Delhi. As Kamal was also pointing out, that the national capital, all eyes would be on the 2 major cities, Delhi and Mumbai. And with the cases, the way we have seen in the last week or so, I mean, Delhi has more or less overtaken Mumbai in terms of positive cases which are coming in every single day. So that remains a big worry. Chief Minister Kejriwal has, in fact, he met Amit Shah even before this meeting just a couple of days back as well. And it seems that all the friction that we were hearing about between the LG office and the Chief Minister's office, that is being ironed out, because at this point of time it will be very important, it will be imperative for all the Central Health Ministry, the government of Delhi and the LG office to work together if Delhi has to tide over these rising number of cases. Because if the estimates come true, no matter how much you prepare, if the burden is about 5-6 lakh cases in less than a month, that is going to put a huge strain on the health infrastructure of Delhi.
Yes, absolutely. And Ankit, it's like you rightly mentioned that their aim is to really contain the coronavirus crisis right here in the national capital, and good to see all of them leave their politics aside and focus on that particular aim. The Chief Minister Arvind Kejriwal has also mentioned about some key decisions that have been taken. We did tell our viewers about how there will be testing capacity that's going to be doubled in Delhi as well. In terms of the capacity addition, we've given them the information, and the key point that you really mentioned, is there any clarity on increasing the number of healthcare workers as well, because we've seen many cases of healthcare workers while treating the COVID patients have tested positive themselves.
Worry is that the hospitals already are, the medical profession already has a lot of strain. So the government of Delhi is planning to in fact get in doctors from the AIIMS facilities, because remember, there is not a very specific specialist that is needed to deal with COVID-19 cases. Largely the management is symptomatic, so they need more all hands on deck rather than very specific field specialists to come in and treat the COVID-19 patients. So there will be some of that health, in fact, staff which will be brought in. Today, Chief Minister Arvind Kejriwal had earlier also asked all private clinics and hospital doctors, nursing home doctors to pitch in. They have been asked to, in fact, contact the government of Delhi if they can help with teleconferencing with patients and other home isolation duties. Apart from that, we have also been told that the government of Delhi would be asking many doctors, those who are in fact on leave, to come back, and there will be the central government also pitching in with increasing the number of health workers in Delhi. A lot of ASHA workers are now being trained in the national capital so that they can help as they can substitute for nurses and also the sanitary staff. So there is an effort being made, but as we've been saying, the effort needs to be done on war footing right now. 2 months were possibly there for preparation. At this point of time, with the rising number of cases, it doesn't seem the already infrastructure which is already in place is enough to cater to the demand. So right now, both the central government and the government of Delhi will have to pull up their socks to meet this demand.
And you're right, because they had the 2 months to prepare. And the very fact that you are seeing such a large increase in the number of cases as well, questions really arising on whether the centre and the Delhi government collectively somewhere did not estimate the rise to be this exponential. But now that they're in that particular position, key decisions being taken, but how far all of them will get implemented, how quickly they will all get implemented, that remains to be seen, Ankit.
That's right, and right now time is of the utmost essence. In fact, the government has been, at least in Delhi, cases are doubling faster than the national average. It's about 15 days Delhi is taking to double its case. The test positivity ratio in the national capital is also very, very high. Of every 100, in the last few days, of every 100 patients, those who have been tested, almost 25 have tested positive. That's 1 in every 4 patients, those who have gone for a coronavirus test. Apart from that, the Delhi government also facing a lot of difficulty in trying to increase the testing numbers and also trying to get the results quickly. The problem was earlier that the large number of tests were being done, but the results of these tests were coming in only after 48 to 72 hours. That serves very little purpose, in a situation like this. Effort is to make sure that test results do start coming in 24 to 36 hours. And all these things are going to, in fact, take time. The important thing right now is that apart from whatever time has been lost, how quickly can the capital recover from where we are standing right now? Because if you go by the projections, they are extremely grim.
Absolutely. Thanks, Ankit, for getting us the perspective on this story. Kamaljeet Sandhu is also joining us live from Delhi, who's got the inside track of what has taken place at North Block, where the key meeting really took place. Kamaljeet, if you could also let us know whether there was any kind of a situation where they discussed there would be a possibility that Delhi might need to go into a lockdown again, given the rise in the number of cases. We do know that the Chief Minister has been absolutely vociferous about not wanting another lockdown, but just look at the situation. Was there any kind of a possibility of another lockdown discussed in that meeting?
Well, our sources indicated there was no discussion. The Home Minister's tweet did not mention anything of that sort. Earlier, Delhi government has also denied any sort of reports which says Delhi could be in a lockdown once again. Now, there is obviously a concern regarding the spike, but coming down to key decisions being taken. One is there will be more tests which will be done. 3 times is the rate of testing which will be increased. So that will benefit all those people. Second, people who are asymptomatic will be given telephonic consultation from doctors in AIIMS. 5 senior officers from Government of India will help out Delhi government in help out in the situation of COVID-19. Then there is a talk about getting the volunteer force, the NCC, the NSS, the NGOs, whosoever is willing to help and can help in situation. Remember, there are cops, there are doctors, there are nursing homes, but yes, they've been exhausted over 2.5 months. Now is a real test when the spike is very much around. That's the time we need volunteer force, especially around hospitals, helping out patients. Remember, this is also something which also puts these people at grave risk. But yes, the government has said, and Home Minister's tweet is very, very clear. They will help out Delhi government in all possible measures, whether it's oxygen cylinders, whether it's ventilators, whether it is any equipment to deal with COVID-19 patients. So very clearly, this is the lockdown again, as some of the states have opted for, is not an option considered in Delhi. This is very clear from the tweets and from the discussions which have happened. Clearly, key decisions have been taken. This is a time where they have to tide over this entire mammoth task. There is absence of vaccine. So this is for a long haul. And that is where the coordination is much more required between centre and state. There is a second meeting which is at 5 p.m. where Home Minister along with Dr. Vardhan will meet the mayors of Delhi. This is where micromanagement will be done. What happens with contract tracing, especially in containment zone, in the hotspots, all this is going to be part of the strategy, and very clearly a tough task at hand. But yes, at this point of time, both centre and state seem to have resolved their differences to ensure that as far as COVID-19 are concerned, that patients do not suffer any longer. But the ground reality is something which will be tested in the times to come.
Kamaljeet, for our viewers who have just tuned in, Amit Shah also put out a tweet where he said, the Home Minister said that many key decisions were taken. Of course, the 500 railway coaches that are going to be given to the government, doubling the testing capacity, house-to-house survey in containment zones, and many such decisions. If you could just enlist all of them in case I've missed out on any.
Well, yes. First of all, one of the key decisions has been that the rates, especially in private hospitals and nursing homes, have been extremely high. They will be monitored. They will be brought down. At least 60% of the beds will be available at reasonable prices. There are 500 coaches which will be made available in trains. Which has been something in the offing right from the beginning of the lockdown. Railways was under preparation. The Delhi government has been in touch with them. So these particular coaches will be made available in the Anand Vihar terminal. This is where isolation wards will be there. Then there are obviously hotels and banquet halls. Both will be associated either with a hospital or with nursing home. There will be assistance provided. This is where medication will be done. This is if the government falls short of beds. We're talking about a spike where there could be on a rise, where there could be anywhere between 1 lakh to 5 lakh people infected with COVID-19. Then there is obviously bringing in the volunteer force, the NSS, the NCC, the NGOs who will be brought in. Again, centre providing more ventilators, more medicines, telemedicine being made available to asymptomatic patients. So we are looking at a consistent rise, but now we are seeing a slight shift in strategy where they have decided what are non-serious cases, and we've seen over a period of time that ICMR has changed its rules and regulation to ensure that whether it is
Kamaljeet Sandhu and Ankit Tyagi with the inside track and inside details of all that transpired in that crucial meeting that took place in the national capital, all of this to contain the COVID crisis and the medical health emergency that the capital is facing on the back of the rising number of COVID positive patients in Delhi. With that, it's a wrap from me, Chaiti Narula, on this bulletin.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.